Good afternoon, Aaron Marcus. My name is Mihiraa. Let's start the warm-up session. How will you make a positive impact on the nursing profession?
There are different ways to contribute to making a positive impact on the nursing profession. Creating feedback forms, as forms helps us secure and promote our jobs and gives us the motivation to work hard. Nurses deserve better working standards and benefits for their hard work. Therefore, listen carefully to what nurses have to say to light down the workload. Additionally, provides continuing education for all to make us stay updated to be the best always.
Describe your ability to handle high-pressure situations.
I have always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
What is the dignity of being a nurse?
Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. One of the dignities of being a nurse is respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy, and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession.
What are the skills I need to be a nurse?
To be a nurse, you need a combination of both hard skills and soft skills. Hard skills are those that are learned through training, education, or certification. Soft skills are habits or traits that enable you to work well with others. Hard skills can be acquired through formal education, such as a diploma, associate degree, or bachelor's degree in nursing, and certification or licensure exams. Soft skills include interpersonal and communication skills that are vital for building rapport and trust with patients and colleagues and can be developed through experience, feedback, reflection, and self-improvement.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. You can now start your roleplay.
Hi there, my name is Aaron Marcus, and I'm one of the nurses here in the emergency department. I can see that you've had a bit of a rough time. How are you feeling right now?
I'm in a lot of pain, and I'm a bit scared, to be honest.
I'm so sorry to hear that. I'm here to help, and will take good care of you. May I know your name, please?
My name is Mihiraa.
Let's go through everything together, step by step. Now, can you tell me a little more about what brought you in today?
I slipped and fell pretty hard. It happened about an hour ago. I was walking down some stairs, and I guess I just missed a step. My arm and leg hurt a lot, and I have a deep cut on my knee.
Thank you for sharing that with me. It sounds like it was quite a painful fall. When you say you fell hard, do you remember hitting your head or losing consciousness at any point?
No, I didn't hit my head or anything, just my knee and my arm. The cut on my knee is what hurts the most. It's bleeding a lot.
I see. It's important that we take care of that wound properly to avoid any complications. Did you do anything to clean or dress the wound after the fall? Have you taken any pain relief?
I rinsed it a bit with water, but I didn't have any antiseptic cream or bandages, so I just covered it with a towel. I haven't taken any painkillers yet.
You did the right thing by rinsing it, Mihiraa. It's good that you kept it covered too. Now, here's what we'll do next. First, I'm going to clean the wound thoroughly to make sure it's free of any dirt or debris. After that, a doctor will come to examine it. Depending on what we find, you might need a blood test to check for any signs of infection, and possibly an X-ray to rule out any bone or tendon damage, especially if your knee and arm are still hurting. Now, Mihiraa, let's discuss the possible treatment steps. Depending on the severity of the wound and the results of any tests, we might need to stitch the cut to close it properly and reduce the risk of infection. Then, we'll also apply a clean dressing to protect the wound and promote healing. To prevent infection, the doctor may prescribe antibiotics. These medications will help fight any bacteria that might have entered the wound. Additionally, you will be given pain medication to manage any discomfort you may experience. Please don't hesitate to ask any questions you have about these treatment steps. I'm here to ensure you're comfortable and well-informed throughout the process.
That sounds like a lot. Why do I need stitches?
That's a good question. It's possible that you might need stitches, especially if the cut is deep or wide. Stitches are really important in helping the wound close properly, which reduces the risk of infection and helps it heal faster. I know the idea of stitches can be worrying, but Mihiraa, they're very effective in making sure the wound heals well. Do you have any concerns or questions about that?
I'm just worried about the pain, and I've never had stitches before.
I completely understand. We'll make sure you're as comfortable as possible. Before any stitches are put in, we'll numb the area so you shouldn't feel any pain during the procedure. Afterward, we'll give you something for the pain to help manage any discomfort. I'll be here to support you through it all.
Thank you, that's reassuring.
You're welcome, Mihiraa. After the wound is treated, it's really important to keep it clean and dry. We'll apply a fresh dressing, and I'll give you instructions on how to change it if it gets wet. You'll need to come back in a few days for a follow-up to make sure everything is healing well. If you notice any signs of infection, like increased redness, swelling, or if the pain gets worse, come back right away, okay?
I'll do that.
I'm glad I could help. The doctor will be in shortly to confirm the best course of treatment for your wound.
Okay, that's fine.
Before we conclude, let's summarize what we've discussed so far. You, Mihiraa, slipped and fell approximately an hour ago, resulting in a deep cut on your knee and pain in your arm. You rinsed the wound with water and covered it with a towel, but haven't taken any painkillers. We're going to clean the wound and examine it to assess the need for stitches. A blood test and X-ray might also be necessary to rule out any underlying injuries. We'll ensure you're comfortable during the procedure and provide pain relief afterward. Once the wound is treated, it's important to keep it clean and dry. We'll provide dressing instructions and schedule a follow-up appointment in a few days. Please seek immediate medical attention if you experience any signs of infection, such as increased redness, swelling, or worsening pain. Do you have any other questions or concerns before we proceed?
No, thank you for explaining everything.
We'll make sure you're on the road to recovery as soon as possible. You're in good hands here, Mihiraa.